Good morning, dear students. Now we are nearly finished of the course of biochemistry, and today's lecture is devoted to metabolism of ketone bodies and cholesterol. Write please the topic of lecture and we will start. At first, what are ketone bodies? These are special small molecules that are synthesized in the liver from acetyl-CoA, and let's write their names and small formulas. These are acetone, acetoacetic acid or acetoacetate, and beta-hydroxybutyric acid or beta-hydroxybutyrate. Put attention that only acetone and acetoacetic acid have really keto group, and this name ketone bodies is absolutely true for them. Beta-hydroxybutyrate has OH group, hydroxybutyrate. This keto group is a part of carboxylic group, so really it's not a ketone. But due to the common fate of these substances, we really combine them in the group which is named ketone bodies. And now we need to understand how the ketogenesis will be done in mitochondria of liver, and for what the synthesis of such molecules will be done. Please, let's go together for the synthesis of ketone bodies. At first, let's write the basic positions that is necessary to study about ketone bodies. Ketone bodies are synthesized, except of acetone, in the liver mitochondria. Liver mitochondria, please underline this. Source for the synthesis of ketone bodies is acetyl-CoA. Mainly its excess is formed during the fatty acid oxidation, but of course you know that this stage of acetyl-CoA is common for degradation of glucose, all amino acids, all other substances that can be oxidized in our body. Ketone bodies are not used in the liver. Special enzymes necessary for their catabolism is absent, it's first. And from the second point of view, it's not necessary for liver, because liver is synthesizing ketone bodies from acetyl-CoA, and then these ketone bodies will bring this carbon to the peripheral tissue for oxidation. If liver already has acetyl-CoA, it's not necessary to use them back for the catabolism. So ketone bodies are transported by blood from the liver to peripheral organs and tissues like heart, skeletal muscles, kidney and brain. Put attention, if you remember, brain cannot do beta oxidation, so long chain fatty acids are not fuels for the brain, but ketone bodies, small molecules, are very good fuel for the brain. And sometimes brain can change its metabolism more than 50% for ketone bodies, not for glucose. Function of ketone bodies is energetic. Value of ketone bodies increased when glucose cannot be normal fuel for the cells. They are synthesized at norm in small quantity, but really their quantity will be increased only if glucose will be non-available, will be absent in the diet long time, or cannot be metabolized, for example, like in diabetes mellitus. Let's go to the synthesis of ketone bodies. It is started from the condensation step of 2-acetyl-CoA. The enzyme necessary for this reaction is named thiolase, because one free coenzyme A will be cut away at this step, And the substance that we will obtain is named acetyl-CoA. One acetyl, second acetyl, so 4 carbons now, combined with coenzyme A. This combination is necessary, as you know, for all active acyls. Next step is attachment of the third molecule of acetyl-CoA, look, and formation of the new for us substance. It's necessary to look at it and understand how its name is formed and how the abbreviation of the name is formed. The substance that is formed by the action of HMG-CoA synthase is named 3-hydroxy 3-methyl glutaryl coenzyme A. Or, as you remember, letter 3 can be changed to the number 3 can be changed to the letter beta if you will use Greek alphabets for numeration of the atoms in this acid. It's a residue of glutaric acid, dicarboxylic acid, which contains 5 atoms of carbon. So this is a residue of carboxylic group. This is a carboxylic group, dicarboxylic acid. 1, 2, 3, 4, 5. Glutaric acid, glutarate. We know glutaric acid from the citric acid cycle. So here we have glutaric acid with 2 substitutions in the third atom, which is also can be named beta atom. So substance that we obtained, it's a beta-methyl, beta-hydroxy glutaryl coenzyme A, or 3-hydroxy 3-methyl glutaryl coenzyme A. Due to these first letters in the name of radicals, H and methyl, our abbreviation is HMG, glutaryl coenzyme A. So 1, 2, 3 acetyls-CoA are combined through 2 reactions, and we are obtaining hydroxymethyl glutaryl coenzyme A, or you can name it HMG-CoA. Next step, action of HMG coenzyme A lyase. Yes, put attention that HMG coenzyme synthase is a main regulatory enzyme here, and further in lyase stage, this process is not regulated, for example, by insulin. It doesn't depend from insulin. So if GMG is formed, lyase can act, doesn't matter insulin present or not. So this splitting of HMG into 1 acetoacetate and 1 acetyl-CoA. It can be non-understandable why at first we are synthesizing, we are including 1 acetyl coenzyme A in this structure, and then we are cutting it. It's necessary to understand that this HMG coenzyme A synthase and lyase action is different. Here we are condensating 2 acyls, here we are obtaining 3 acetoacetate. And this small water-soluble molecule can after this go directly to the blood. All acyls which are combined with coenzyme A, we told about coenzyme A, like about great head of kite, to which all residues of acids can be attached with different lengths. Here we can obtain acid without this kite head, for which membranes are impermeable, and it means that acetoacetate after this can go to the blood, to the peripheral tissue. So the next step, lyase reaction, splitting of HMG to acetoacetate and acetyl-CoA. This free acetyl-CoA can go for oxidation or for the synthesis of new molecules of ketone bodies. It doesn't matter. It is free. So next stage, we told that normally this synthesis of ketone bodies will be done mainly in excess of acetyl-CoA, which is a result of fatty acid oxidation. If you remember, during fatty acid oxidation, each step of splitting of long chain fatty acid and cutting thiolysis of acetyl-CoA, this cycle, this cutting, is accompanied with the formation of FADH2 and NADH2. And if FADH2 in, for example, non-saturated fatty acids is not formed, NADH2 is formed per each cycle of cutting of beta oxidation. So it means that in parallel with excess of acetyl-CoA, usually in liver, in mitochondria of liver, because fatty acid oxidation is also will be done in liver, we have normal quantity, enough quantity of NADH2. And this why the most important and most represented ketone bodies in our body, it's a beta hydroxybutyrate, not acetoacetate. Acetoacetate, by the action of beta hydroxybutyrate dehydrogenase, easily converted to beta hydroxybutyrate. Dehydrogenation will be done as usually near keto group, and from keto group we will obtain hydroxy group. So the solubility of these molecules is higher, and together with acetoacetate they both can go to the blood. Spontaneously in the blood, acetoacetate can be cut and produce acetone. Acetone is not normal for us product. It's a complication of all the processes, and please indicate that acetone is a product of decarboxylation of acetoacetate in blood. It's important. Liver is not synthesizing acetone. It's a mistake. Moreover, very small quantity of acetone can be detoxified in liver. But most of the acetone is non-usable, non-useful for us, and we will excrete it together with urine, because renal threshold for the ketone bodies is very low, and together with the evaporated water, with our breathing, so acetone will go away. We are excreting with urine, with sweat, with the air. So in case of ketosis, in case of great quantity of acetone in urine and sweat in blood, the smell will appear from the patient with high concentration of this acetone, especially this fruit smell or nail fluid smell. So let's repeat the stages and go further. Thiolase reaction, condensation step, two acetyl-CoA are combined, acetoacetyl-CoA is formed. Third molecule of acetyl-CoA will be combined with acetoacetyl. We are obtaining HMG, 3-hydroxy-3-methyl-glutaryl coenzyme A. Lyase reaction will take away one acetyl-CoA and we returning to the acetoacetate, but free without coenzyme A. This is our first ketone body, which is easily dehydrogenated, hydrogenated, hydrogen is attached, and beta hydroxybutyrate is obtained. Acetone is formed by decarboxylation directly in blood and will be excreted from the body. It will be not utilized. Let's look how this process is regulated. As we told, the main regulative enzyme is synthase, HMG synthase. The most important factor that will block action of HMG coenzyme A synthase is a free coenzyme A, without acyls, without residues of acids. Look, free coenzyme A, inhibitor. But free fatty acids, which are realized in the processes of lipolysis, where does it activated from adipose tissue, fatty acids are revealed and go to the peripheral tissues, including liver. And free fatty acids, these are inductors of the synthesis of HMG coenzyme synthase. So normally we have not really high level of free fatty acids in our body, you know, glucose is absorbed mainly and activate its oxidation, conversion it to glycogen and then. But when glucose is not available, free fatty acids are released and induce the synthesis of HMG synthase. Look, what is a button to start lipolysis in peripheral adipose tissue? Of course, it's a ratio between glucagon and insulin. When it will grow, it means insulin will be in lower quantity or will not be recognized by the cells. Glucagon and adrenaline in high level can start lipolysis. In its order, free fatty acids will be combined with free coenzyme A. It's a first reaction of activation of all acids, formation of acyls coenzyme A. Remember about this step. Will decrease the concentration of free coenzyme A. Free coenzyme A, as we told, is inhibitor of synthase. So if fatty acids are coming and acyl coenzyme A synthase will take free coenzyme A for the formation of acyls and further beta oxidation, the concentration of free coenzyme A, of course, will be decreased, and in this case negative action of free coenzyme A to HMG synthase will be decreased. Free fatty acids will stimulate the synthesis and ketone bodies or ketogenesis will be activated. How the ketone bodies are catabolized in the peripheral tissues? As we told, water-soluble molecules easily come to the blood and easily come from the blood to the peripheral cells, where they can be oxidized. At first, beta-hydroxybutyrate by the same enzyme but in peripheral cells will be dehydrogenated and NADH2 will be formed. Of course, if we are taking two hydrogens here and keto group appeared, we back obtained acetoacetate. Then we need this special enzyme which is named teophorase. It's a transferase that will take coenzyme A from succinyl-CoA. Succinyl-CoA, you know, this is a metabolite of citric acid cycle, so in mitochondria it is present, and transfer this coenzyme A to acetoacetate. By this way, it is activated like all acids. So acetoacetyl-CoA is formed. So now we have active form of acetoacetate. Unfortunately, you know that if this reaction will be done by succinyl coenzyme A synthase in the citric acid cycle, we will obtain 1 GTP here. But if this step is catalyzed by teophorase, we are losing this 1 GTP, 1 ATP. It's equivalent. But its step is necessary for the activation of our acetoacetate. Teophorase, it's enzyme specific only for peripheral tissue. It is absent in liver. We will mark it a little bit further. What will be with acetoacetyl-CoA? By the keto-tealase, the same enzyme like in beta oxidation, it can be coated with the attachment of free coenzyme A. Teolysis. We told about this reaction about teolysis and keto-tealase. In comparison with simple tealase in beta oxidation, can also give us 2 molecules of acetyl-CoA. As I told you, please mark and put attention that teophorase is absent in liver, and this is one of the reasons why ketone bodies are not used in this organ. The second reason is the biochemistry logic, in which it is not necessary. We started from acetyl-CoA, we return it to acetyl-CoA in peripheral tissue. So liver already had this acetyl-CoA and could use it for oxidation directly without the stages of synthesis and degradation. Let's discuss energetic effect of the process. 1-hydroxybutyrate molecules, when oxidized at first reaction of dehydrogenation, will give 3 ATP. Then we need to calculate -1 ATP for the activation of acetoacetyl by losing of 1 GTP in the citric acid cycle, and 2-acetyl-CoA in the citric acid cycle. We can now calculate this easy because we know strongly remember that each acetyl-CoA is 12 ATP in citric acid cycle. So here 24 plus 3, 27, minus 1, 26 molecules of ATP is possible to obtain from 1 beta-hydroxybutyrate, 3 less from 1 acetoacetate. But as I told you, usually our general, the more concentrated ketone bodies is beta-hydroxybutyrate. So what is this? This ketogenesis, for what it is necessary? Really, it's like a transport of acetyl-CoA to the peripheral tissue, because acetyl-CoA is a source of ketone bodies that will go by blood to the peripheral tissue, for example, muscle, cardiomyocytes, brain cells, and will be converted back to acetyl-CoA. Acetyl-CoA cannot do it itself because this coenzyme A, head of kite, prohibits to pass through the membrane. And this is very good way to synthesize water-soluble small molecules to transport this acetyl-CoA directly here for the citric acid cycle. Usually, liver is working with glucose. Liver is maintaining level of glucose in the blood by the absorption after meal, oxidation to obtain energy. Excess of glucose is converted to glycogen, and usually between uptake of food, our glycogen is enough to supply us glucose level. And excess of acetyl-CoA usually is not formed. It is formed only if quantity of your food and quantity of calories that is present in your food, daily food, is significantly higher. And normally, liver is also synthesizing ketone bodies because enzymes are, genes of enzymes are expressed a little bit, and they are synthesized and working in small quantity. Why? Because ketone bodies are very acidic. They can change the pH of blood. It's good way, but complicated with change of pH. It's not necessary for the organism, and due to this, usually we are using glucose. But there are some situations at which quantity of ketone bodies will be significantly increased. So what situations can lead to the ketosis, to the increased quantity of ketone bodies in the blood? At first, this is a starvation. Our glycogen is able to maintain level of glucose nearly 24 hours. 24 hours. Then it will be depleted and gluconeogenesis will be started. Gluconeogenesis, if you remember, is started from the formation of oxaloacetate and then conversion of oxaloacetate to the phosphoenol of pyruvate. So oxaloacetate, it's the first metabolite of citric acid cycle. The first reaction, if you remember, this is a citrate synthase reaction, condensation of oxaloacetate and acetyl-CoA with the formation of citrate. So when gluconeogenesis is started during the starvation, the velocity of citric acid cycle is decreased a little bit due to the depleted decreased concentration of oxaloacetate. Look here to the scheme. This is a citric acid cycle, and oxaloacetate is both metabolite of citric acid cycle and gluconeogenesis. So what will be in this situation? Of course, in this situation where glucose will be maintained only for the brain by gluconeogenesis, under the action of adrenaline and glucagon, glucose is absent, insulin is not necessary to secrete, will stimulate degradation of fatty acids, and beta oxidation will lead to the formation of great quantity of acetyl-CoA. Then after this, as we told, free coenzyme A decreased the ketone body formation. Acetyl-CoA, when appear in the excess with in parallel decrease of concentration of free coenzyme A, will stimulate GMG synthase, and acetoacetate and beta hydroxybutyrate will be formed. Acetone, as you remember, here must not be written because it is formed only in the blood, not in liver. Liver is not producing acetone. Then acetoacetate and beta hydroxybutyrate export this energy that is present in the liver and gives fuels for all organs and tissue. This is a normal adaptation for the starvation, and very long time we can live on the ketone bodies because we have stored lipids that are degraded in this state step by step, and even brain can change normal 10% that it can use 10% of all fuels that it can use for the oxidation to the 50% and even a little bit more, till 3/4 of energetic requirements of brain can be covered by ketone bodies at the end of starvation. It means after 2-3 weeks of complete starvation. Another situation in diabetes mellitus. In untreated diabetes mellitus, insulin will not be produced in the first type of diabetes, or will not be recognized by the receptors in second type of insulin, so it is similar, like it is absent. And due to this, glucose is present in the blood but cannot be uptaken by cells. In this case, in absence of insulin, you remember we told that insulin is inducer of malonyl coenzyme A formation from acetyl for carboxylation of acetyl-CoA, and this pathway to shunt, to channel excess of glucose for the fats formation will be closed. In this case, fatty acid oxidation is increased because you remember that malonyl coenzyme A is a main inhibitor of acyl-carnitine transferase, regulative enzyme for the beta oxidation. So if malonyl is decreased in concentration, fatty acid oxidation is increased, and of course this will create excess of acetyl-CoA and ketone bodies formation. But if regulative action of insulin will be taken away in case of untreated diabetes mellitus, of course this ketosis will be uncontrolled. All the coenzyme A, all the acetyls coenzyme A will go to the ketosis, because all other pathways for acetyl-CoA, like fatty acid synthesis or cholesterol synthesis, we will talk about this today, and oxidation of acetyl-CoA in the citric acid cycle in case of low insulin is impossible. Only ketosis, only ketogenesis. And the third situation, it's a diet, special diet with a low quantity of carbohydrates, when even great quantity of fats can be used and proteins. But in this case, step by step, people can increase the uptake of fats that are stored in adipose tissue, because if glucose is not coming, the same mechanism will be started: degradation of fatty acids and ketone bodies formation. So keto diet, it is imitates the starvation, and step by step, not so quickly like in complete starvation of course, but slowly will lead also to the change of feeding of our tissues by ketone bodies. Ketosis will be observed, but if patient is in health, it can control and regulate this ketosis, because low quantity of carbohydrates is coming and low quantity of insulin will be synthesized, and the process of oxidation of carbohydrates will be also done, but not in so high velocity like at normal people. So once more, in the simple scheme, acetyl-CoA, that is mainly excess of which is mainly formed by the fatty acid beta oxidation, but of course can come from glucose normally can be oxidized in the citric acid cycle, and normally this pathway is a general way of catabolism. Oxaloacetate is an intermediate in this process to form citrate and to be oxidized and give us energy. But the small quantity excess of acetyl-CoA, for example, in the case of glucose excess, can be converted to ketone bodies normally. Yes? In case of activation of gluconeogenesis from oxaloacetate, this pathway will not be done, and more quantity of acetyl-CoA will go to the ketone bodies formation. So fatty acid oxidation plus lack of oxaloacetate, these are most important reasons for the activation of ketogenesis. More important reasons for this is fasting or untreated diabetes. It's a simple scheme that easy to rewrite. I hope that you will fix it in your notes and answer on all questions about ketone bodies good during the lessons. Please write that the normal content of ketone bodies in our blood must not be higher than 0.2 millimole per liter. More often the concentration is measured by the special color sticks in urine. Why? Because, as I told, the renal threshold for the ketone bodies is very, very low, and if their concentration is higher than 0.2, they will be started to absorbed in the urine. Write please the definitions of terms. What is ketonemia? Ketonemia, it's a situation where the content of ketone bodies in the blood is increased. Ketonemia, not hyperketonemia, because normally, as we told, very, very small quantity is present. And ketonuria, also not hyperketonuria, only ketonuria. Ketone bodies are not absorbed by the biochemical methods. It is not possible to determine their presence when so small quantity in the blood. And they are filtrated, of course, in small quantity, but significantly less quantity, so cannot be found, cannot be opened in the urine. So ketonuria, it's excretion of ketone bodies with the urine. Presence of ketone bodies in urine is named ketonuria. And as a result of ketone bodies accumulation occurs an alkaline reserve of blood decreases and pH shifts to acidic side. If the long time in our blood beta hydroxybutyrate, acetone and acetoacetate are present, pH of blood can be changed. It can be dangerous for the functioning of all of the cells of the blood, for the concentration of different substances in our blood, and of course for the conformation of our proteins that are very sensitive to the changes of pH liable. So ketoacidosis, it's a state of organism which is formed in case of overproduction of ketone bodies. What states can be accompanied with this? We told this is fasting. In this case, ketosis is controlled and not so high. And in diabetes mellitus, this ketosis can reach very high significances and very high values, and in this case even lead to the formation, to the development of ketoacidic coma and death. This is one of the reasons of death in diabetes mellitus. Let's talk about metabolism of cholesterol. Cholesterol here is represented by usage of different models, yes, the Bowles models, the graphic models, must be easily recognizable, this formula, because it's a first steroid with which we were met during the course of biochemistry. Look, 4 rings, usually we are writing these 4 rings schematically, and the special tail here near pentan ring, it's a tail of itself, when we are writing detail near for rings on the schemes, usually we means the fatty acids that is esterified here. And cholesterol cannot be named no simple, no complex lipid. It's absolutely another structure, steroid structure. It's alcohol, one OH group is present in the structure, and put attention that this presence of OH group gives a little bit polarity for this molecule and allow to this molecule to participate in different formation of micelles, participate in the formation of and functioning of membranes, and then, because a little bit hydrophilic OH group can be oriented together with other amphipathic molecules to the special structures. And this hydrophobic part, of course, must interact with hydrophobic fatty acid tails or rings of bile salts or tails of acids in the structure of monoacylglycerols or diacylglycerols or phospholipids. Let's write that cholesterol is a derivative of steran. That's why all derivatives of cholesterol are named steroids. Steroids, all substances that contain such a special ring in the base of structure of molecule are named steroids. What is steran? Steran is a condensated to 3 benzol rings and 1 pentan rings, named cyclopentan perhydrophenanthren or steran. Phenanthren, these are 3 dehydrogenated benzol rings combined. Perhydrophenanthren, it means that it is saturated, all the cycles are saturated, and cyclopentan is a saturated cyclic hydrocarbon structure. When they are combined by this way, we are obtaining steran. Look to the numeration, please, it's important. Rings are numerated A, B, C, D, especially by this way, to indicate infer the position of different radicals and substituting groups. And numeration is started against of normal watch way 1, 2, 3, 4, 5, then go by the down part and finish with the 10th atom here, then continued started from the not nearest, but the next jumping to the ring C with 11, 12, 13, 14, then again continue by the down part 15, 16, 17. All other cholesterol numbers are in the chain, but here we have only especially basic structures, steran or cyclopentan perhydrophenanthren. Please fix somewhere that nearly 1 gram of cholesterol is synthesized in our body, so-called de novo, from something else, from acetyl-CoA. And this cholesterol we will name endogenic. More than half of this quantity is synthesized in liver, 15-20% in small intestine, and other cells also participate, like skin, adrenal cortex, sex organs, all other percentage for them. And near half of the gram is obtained with our food. This cholesterol we are naming exogenic. Endogenic and exogenic cholesterol. If we will block uptake of exogenic cholesterol, believe me that there are mechanisms that will increase the endogenic production. So if you will fight with hypercholesterolemia in your patients, remember please about regulative mechanisms. Only diet with decreased quantity of cholesterol, it's not a pathway how to decrease level of cholesterol in the blood. In our body, cholesterol is a precursor of different substances. At first it participates in the formation and action of membranes. Then it is a precursor of steroid hormones that are synthesized in the adrenal cortex, in our sex gland, in placenta in pregnant women. Bile acids, of course, derivatives of cholesterol necessary for the absorption, for the digestion of dietary lipids, and for their emulsification, activation of pancreatic lipase, and then also from cholesterol we can synthesize in our skin under the action of ultraviolet light small quantities of vitamin D. Indicate these most important pathways to use cholesterol in the organism, and we will go further. Note somewhere that there are the substances in our body that we can synthesize but cannot catabolize completely to CO2 and water. If we will talk about glucose, amino acids, fatty acids, it's possible, of course, glycerol, but for example, heme cannot be cutted completely in our body. It will be converted to bilirubin and excreted from the body. And the same cholesterol. This ring we can synthesize, we can obtain it, but cannot cut it completely to CO2 and water. And we will excrete this cholesterol together with the bile, with our feces. Or we'll lose this cholesterol as a part of cell membranes with the cells that we are losing all the days. These are our hairs, skin, scales, then mucosa cells. Write please and put attention for the 4 stages of biosynthesis of cholesterol. We divided this biosynthesis to this 4 stage to make study easy for you. Actually, with reactions you must know only first stage, mevalonic acid formation, and I will tell you that it is very similar to the reactions that we already passed, reactions of ketone bodies synthesis. Only one note must be underlined, that biosynthesis of cholesterol will be done in cytosol of all mentioned above cells. Cytosol, not mitochondria. Ketone bodies are formed in mitochondria. Cholesterol is synthesized in cytosol. Same fatty acids are oxidized in mitochondria via citric acid cycle, via electron transport chain, because oxidation is the production of reduced coenzymes of dehydrogenases, NADH2, FADH2 to start transport of electrons, to start formation of electrochemical potential and ATP production. This is the order of oxidation, obtain of ATP. In synthetic anabolic processes, we are using ATP to produce something necessary for us or to do some functions. It's anabolism, anabolic stage of our metabolism. So let's write these 4 stages and then we will look to them in detail. First stage, it's a condensation of 3 molecules of acetyl-CoA to form 6 carbon intermediate. Mevalonic acid through this stage of HMG, you will see this similar to the synthesis of ketone bodies. Then, at the second stage, this mevalonic acid will be converted to the active isoprenic units for the further elongation of the chain, from which then cholesterol will be formed. Third stage, it's a polymerization of 6 molecules of these 5 carbon isoprene units to form 5. Let's multiply on 6. We will obtain 30 carbon linear chain, which is named squalene. So the third stage, it's a formation of squalene. And cyclization of the squalene to form really cholesterol through the stage of lanosterol. This is not necessary to learn with the formulas because it's a very hard task to write 30 carbon sequence. This you need to know only in words and look to the picture to remember the view of the process. But mevalonate formation you must know with reactions. So let's go stage by stage to complete molecule of cholesterol. At first, as we told, synthesis of cholesterol, like synthesis of fatty acids, will be done in cytosol. Acetyl-CoA, which is initial for the synthesis of cholesterol, is produced in mitochondria from glucose or from beta oxidation, anyway, in mitochondria. So must be shuttle how to transport this acetyl-CoA from mitochondria matrix to cytosol. It's the same shuttle like for synthesis of fatty acids, nothing new. Acetyl-CoA by the citrate synthase, same enzyme for the beginning of citric acid cycle, is converted to citrate. But if we have well-fed state, ATP is in abundant quantity, citrate is not go to the citric acid cycle but accumulate in great quantity and transported to the cytosol to be cutted by citrate lyase with the usage of ATP, of course, to acetyl-CoA. So this acetyl-CoA and this acetyl-CoA equivalents, and this is the so-called citrate shuttle, or simply mechanism to transport acetyl-CoA from mitochondria to the cytosol. Then you know that citrate is converted to oxaloacetate, 4 carbon units, so 2 carbon units here and 6 carbon units here, which can be converted to malate with the help of malate dehydrogenase. Actually, malate can go back to the mitochondria to be oxidized by malate dehydrogenase back to oxaloacetate. It's also citric acid cycle reaction. Or with the special malic enzyme, malate can be converted to pyruvate for what it is necessary. This can increase quantity of NADPH2 in the cytosol, because malic enzyme in comparison with malate dehydrogenase produces NADPH2, which is necessary for the reductive reaction in synthesis of fatty acids and, as you will see, in cholesterol synthesis. So at first stage, synthesis of mevalonic acids, reactions already known for you, repeat two first reactions, repeat the reactions for the synthesis of ketone bodies, because our order is to obtain the same substance, beta-hydroxy, beta-methyl or 3-hydroxy-3-methyl glutaryl coenzyme A. For this, at first step, thiolase will condensate 2 molecules of acetyl-CoA. Then formatted acetyl-CoA by the synthase action are converted to beta-hydroxy beta-methyl glutaryl HMG, and here we have different pathway. At first, we must all the time remember that these two reactions are performed in cytosol if we are synthesizing cholesterol. If it is ketogenesis, both reactions and all further reactions are produced, are carried out in mitochondria, here in cytosol. And then the special enzyme, name of which is necessary to learn, GMG coenzyme A reductase, of course this is dehydrogenase, but to underline great role of reduction in this reaction, better to name it reductase. It's easy to remember and separate it from the HMG lyase from HMG in the ketogenesis. Look that for this reaction, beta-hydroxy beta-methyl glutaryl must be reduced with the 4 protons, with the 4 atoms of hydrogen. Look, coenzyme that participates in this reaction is NADPH2. If you remember, NADPH2 differs from NADH2 by the presence of phosphate in ribose. Phosphoribose is present in the structure of NADPH2, and usually this coenzyme is not used for the transport of electrons in electron transport chain, but will work in cytosol as a donor of protons for the reduction reactions. The sources for this NADPH2, of course, that malic enzyme that I mentioned above, and greatest source, of course, pentose phosphate pathway. When we learned pentose phosphate pathway, we told that the greatest role of this pathway is to produce reduced NADPH2 for the synthetic reactions, for the synthesis of fatty acids and cholesterol, for lipogenesis. And this is the one of the branch between carbohydrate and lipid metabolism. Next lecture will be devoted to integration between carbohydrate and lipid metabolism. This is the one of the branch, one of the connection between these two great parts of metabolism of carbohydrates and lipids. More others connections we discussed today also. This is interaction through the acetyl-CoA between fatty acid degradation and glucose degradation, gluconeogenesis, how does it influence to the velocity of ketogenesis, and then. So many connections are now, and many connections you know now, but to fix them, to list them all, you will have the special lecture. Here we need to finish to write our reaction with the formation of acid, which is named mevalonic acid. Look, special 2 OH groups. Actually, what these 4 hydrogens are doing, 1 hydrogen is used to close our coenzyme A, and 3 hydrogens will be attached to the structure of our mevalonic acid. Yes, and finally we will obtain 2 hydroxy groups, 1, 2, 3, 4, 5, 6 atoms of carbon. So we started from 3 acetyl-CoA, and we now have 6 carbon in the structure of mevalonic acid, 2 hydroxy group and carboxylic group, because it's acid. Anyway, this is acid. Don't confuse with malonyl coenzyme A, which is initial substance for the biosynthesis of fatty acids and formed from 1 molecule of acetyl-CoA by the reaction of carboxylation. Malonyl-CoA, it's a acyl coenzyme A activated 3 carbon units structure, which is used by palmitoyl synthase for the synthesis of palmitate, for the synthesis of fatty acids, regulative substance, inhibitor of acyl-carnitine transferase. And mevalonic acid, don't confuse mevalonic acid, mevalonate. It's a substance that is formed from HMG in the pathway of cholesterol synthesis after the action of HMG reductase. Mark please that HMG reductase, the main regulatory step for the synthesis of cholesterol in all processes. Put attention. The same approach we are using to study substrates, products, names of the enzymes, and then indication at what stages it is possible to influence to the velocity of the process. Regulation is the most important, because if you know how the process is regulated, you can be chief of the situation. If you know the connections between carbohydrate and lipid metabolism, you can influence with special drugs. It is easy to understand their mechanism of action, easy to understand their interaction one to another, how do they act together, for example. And your treatment, it will be creative process in this case. So mevalonate formation, it's a first stage, and these reactions you must learn and write them, same like reactions of glycolysis, citric acid cycle, and then it's easy that 2 reactions for ketogenesis and 2 reactions till formation of beta hydroxy beta methyl glutaryl are the same. Only one note that they are performed for ketogenesis in mitochondria, for the synthesis of cholesterol in cytosol. Let's go further. The stage 2. This very complicated sequence of reaction is not necessary to learn. It's our gift for you. You must only name this stage and understand what will be done in this stage. Mevalonic acid will be at first activated. Look, again, phosphorylation is used for the activation of this 6 carbon unit 2 times, and to obtain pyrophosphormevalonic acid. Pyra, it means diphosphate. Then the special kinase converted to the 3-phosphor 5-pyrophosphormevalonate. So to activate this 6 carbon chain, 3 ATP molecules will be used. So this is energetically requirements of this process is very high. Only when energy will be in enough quantity we can synthesize cholesterol. Actually, all synthetic processes, they require big quantity of ATP. So synthesis and increase of body weight is possible only in well-fed state when all mechanisms are working. And this 3 times phosphorylated mevalonic acid after 1 decarboxylation will give 5 carbon isoprenyl pyrophosphate, which after this will be isomerized to obtain dimethyl pyrophosphate, allyl pyrophosphate, the substance that after this will start to be condensated. As I told you, subsequently with the formulas is not necessary to learn. You only must remember that on the second stage, after several times of activation of phosphorylation, mevalonate will be converted to the special active isoprenic unit that will be elongated, polymerizated on the stage 3. Also, these names akeranil, farnesyl, don't learn them. Stage 3, polymerization of isoprenic units to form 30 carbon linear squalene. Quantity of these units is easy to remember. If you will remember that squalene is a 30 carbon chain, so 6 of molecules is polymerized. From mevalonate, 5 carbon isoprenic unit is formed. So here will be easy to understand. Isoprenes will be combined with the special enzyme, and then chain will be elongated, elongated, and elongated, and finally, after condensation of two farnesyl pyrophosphates, we will obtain squalene. It's a chain that already gives us walls for the formation of rings. Squalene, 30 carbon linear polyisoprenic substance that on the 4th stage must be cyclized with the special enzymes that help in this process. Enzymes actually are localized on the endoplasmatic reticulum, and these are representatives of the enzymes which we are naming enzymes of microsomal oxidation. Not in microsomes, in endoplasmatic reticulum they are localized and helps for the cyclization of squalene and further formation of lanosterol and finally cholesterol. Look to the formula of cholesterol, OH group, in the 3rd position. Double bond here in the 2nd ring, in ring B. 2 methyl radicals between A, B and C and D, and the special chain, carbohydrate chain, which is started, put attention to the 17th atom, not here, not here. Even if you will write molecular with another angle, remember the number of atom of carbon where this side chain is started in structure of cholesterol. Structure of cholesterol is necessary to learn, of course. So this is the synthesis of the basic for all steroids molecular cholesterol. Let's talk about regulation of cholesterol synthesis. It's not simple thing, so let's write step by step what mechanisms are used for the regulation of cholesterol synthesis. It's one of the central problem, this hypercholesterolemia and atherosclerosis for the humanity. So put attention for the regulation of this process. At first, more easy to remember that there is a feedback inhibition of HMG reductase by cholesterol. So the final product, cholesterol, can inhibit HMG reductase. Simple feedback inhibition. HMG reductase activity is regulated not only by this simple allosteric mechanism, but also by phosphorylation, dephosphorylation, And these processes, are under the control of hormones. So second mechanism is the hormonal regulation of cholesterol biosynthesis. In brackets indicate that this is phosphorylation and dephosphorylation mechanisms. Active form of enzyme is formed under the action of insulin, because same like acetyl-CoA carboxylase, anabolic enzymes, they are under the action of insulin, because for their functioning phosphates must be absent. They are active in unphosphorylated state, same like glycogen synthase, also insulin group enzyme, which must be dephosphorylated for their activity. Insulin answers to the activity protein phosphatases, and due to this insulin is stimulator of cholesterol biosynthesis. Then glucagon in its order decrease the synthesis of cholesterol by increase of the formation of inactive phosphorylated form of HMG synthase. Phosphorylated enzymes which are active in these states, this is glycogen phosphorylase, this is tisual lipases. So this enzyme mainly directed to the cleavage of something, to degradation of something. Insulin is a synthetic, is a host hormone. It will activate only phosphatases, they will cut phosphates from the proteins enzymes, and enzymes will be activated. This group. Glucagon will activate enzymes which necessary to phosphorylate by the action of protein kinases. So let's write mechanism 2. Regulation by glucagon and insulin, phosphorylation, dephosphorylation mechanisms. It's necessary to remember that this is similar to the regulation of acetyl-CoA carboxylase. So synthesis of cholesterol very often is will be done in parallel with the synthesis of triacylglycerols, phospholipids, fatty acids, elongation. Maybe esters of cholesterol will be formed after formation of cholesterol. So these are processes that can be performed in well-fed state when ATP is in an abundant quantity, when protein kinases will not work, when phosphatases will work, protein phosphatases, and when all the lipids will be synthesized. The third mechanism, sterol-mediated regulation of transcription. Cholesterol is taken for the cells from the liver and from the intestinum by chylomicrons at first, and then by very low density lipoproteins, and they will decrease the biosynthesis because transcription of the gene which is coding HMG coenzyme A reductase will be decreased. So when cholesterol will be taken from the cells, the biosynthesis will be decreased. So it's a special mechanism that will be realized at the level of transcription of DNA. And fourth mechanism that is represented here, this is special for you as a medics, that this is inhibition of drug by the usage of drugs. Analogous of cholesterol, lovastatin, mevastatin, common name is statins, are competitive inhibitors of reductase. This is competitive inhibition. If normal inhibition by cholesterol, by the final product, native to the cells, is named feedback inhibition. Here we are using competitive inhibition. Why competitive? Because the structure of mevastatin and lovastatin is similar to the structure of normal cholesterol, but they are metabolized significantly more easy, and they are not causes of complications that can be developed in the body in case of high concentration of cholesterol. So let's look to the liver metabolism of lipids as a simple scheme. After formation, fatty acids in liver can be used for the formation of liver lipids, of course, phospholipids, so small quantity of triglycerols which is stored in the liver, or they can go to the into the structure of plasma lipoproteins and be transported to all the cells. So liver can supply our peripheral cells with cholesterol, with phospholipids, with triacylglycerols, and with ketone bodies, as we know. All sources of acetyl-CoA can be sources for the formation of cholesterol, then formation of bile salts, steroid hormones, and vitamin D. Excess of acetyl-CoA can be converted to ketone bodies. Normal pathway to be oxidized citric acid cycle that will give us energy by the process of oxidative phosphorylation. Put attention that conversion of cholesterol to the bile salts, it's a pathway how to excrete excess of cholesterol from our body. Anyway, we need to lose special quantity of cholesterol each day. Other way, hypercholesterolemia will be formed, or the problem with the formation of bile and functioning of hepatocytes will be done. So normal excretion of bile, it's a condition for the excretion, normal excretion of cholesterol. Small quantity of free cholesterol is present in the bile, and of course bile salts are synthesized from cholesterol, and the balance between quantities of cholesterol, bile salts, phospholipids in the bile, it's a reason why bile will be fluid at norm. In healthy people, bile is fluid, and it must pass from the gallbladder at the special time to the small intestine, to the duodenum, where participates in digestion and absorption of lipids. But sometimes this balance can be disordered, and in this case the cholelithiasis can be developed. Cholelithiasis, according to the name, it's a formation of gallbladder stones. Bad disease, with the pains, with the disorder of digestion and absorption, with nausea, with the problems with passage of the chymus through the intestinum, sometimes with a jaundice formation if stones will block the passage of bile, normal passage to the intestinum, and then. Look to the composition of gallbladder stones represented here. They can be nearly completely formed from cholesterol, they can be mixed, and sometimes low cholesterol containing gallbladder stones are formed. They name it pigment. More often we can see cholesterol gallbladder stones with the more than 80% of cholesterol present in these hard particles with different size. It's one of the disorder of the production of bile and one of the disorder of metabolism of cholesterol. Disorder which is mainly explained by the disorder imbalance between phospholipids, bilirubin production, quantity of calcium in the bile, quantity of bile acids, activity of enzymes that are synthesizing bile acids from the cholesterol in liver, and different other reasons like infection, like precipitation of epithelia in the gallbladder of microorganisms, disorder in the feeding regime, or something like this. About this disease with symptoms and then you will study on the senior courses. At this moment, only remember that disorder in the cholesterol exchange, it's not only cholesterol atherosclerosis. There are some other problems that can be combined with the disorder of fats metabolism. Let's remind some of them. About steatorrhea we taught on the lecture about digestion of lipids. Lipase deficiency, liver diseases and problems with bile secretion and excretion, intestinal cell inflammation, everything can lead to the decreased absorption of and digestion of lipids and steatorrhea, presence of fats in feces in big quantity. Then remember that there are inherited problems with the beta oxidation, for example carnitine deficiency, and problems with the transport of fatty acids. I also told you about the problems with enzymes, for example for medium chain fatty acids oxidase, first stage of dehydrogenation, which is combined with unexpected death in newborns. Then these are different types of hyperlipidemia depending from the ability of the liver to produce apoproteins, ability of the receptors to recognize different lipoprotein particles, because it's a very problematic thing to transport lipids between different organs and cells, from liver to peripheral cells, cholesterol from peripheral cells to the liver. For this, our lipoprotein lipase must be active, sometimes it is inactive. For these apoproteins must be synthesized in normal quantity, and of course they must not be problems with diet. And finally, abnormal metabolism of cholesterol, which is combined with atherosclerosis development. About this, 2 slides later, a little bit more detailable. Put attention to the phenomenon of the change of our blood after uptake of fat foods. Chylomicrons that are formed in the intestine will change the permeability, transferability, and view of our blood, in case if lipoprotein lipase can quickly take these chylomicrons from the blood flow. Normally this can be observed with the lymph, this milky view of lymph and blood serum after uptake of food due to the formation of chylomicrons. It is a little bit another view of blood serum in case of lipoprotein lipase deficiency. This hyperchylomicronemia will significantly change and for long time change the color and transparency of our blood serum. It is visible even simply with our eyes. And that's why even in healthy people we are taking blood for analysis for the determining of different biochemical values only on empty stomach. So at least 8-10 hours patients must not take food to give us blood for analysis, because this presence of great quantity of lipid sticky particles will sometimes change the results of the tests and do not allow to do them correctly, precisely. About atherosclerosis, several words, what we will be in time to see. Here you can see and analyze the more important risky for the development of atherosclerosis. We are of course inherited. Things are important via the different problems with the type of life, like alcohol, obesity, smoking is important, parallel diabetes mellitus, or hypertension also important. And one of the risk factor, it's a high level of cholesterol. Actually, total cholesterol is not so important. It is important how it is represented between bad and good lipoproteins. About this a little bit further. And what are symptoms and signs of atherosclerosis? Of course, these are different cardiac attack, these are shortness of breath, finding, it's a nausea, sweating, weakness, palpitation, bradytachycardia, so problems with cardiac rhythm. Actually, it's difficult to recognize that all of these different symptoms are really reasons for atherosclerosis. But you know that it is more younger and younger in our population, so if even there are no inherited problems with the degradation, catabolism, and transport of lipids, nearly 30 years the first symptoms will start. Now the diagnostic is easy, so do not ignore any symptoms that can tell you about start to formation of atherosclerosis in the patient. Let's look to the very simplified scheme of lipoprotein formation and circulation after formation of chylomicrons in the intestinum after the uptake, yes, of dietary fats. Look, bile acids are secreted to the intestine and then reabsorbed. It's a enterohepatic recirculation is shown here. So chylomicrons, it's a ultra low density lipoproteins. You remember that this is a drop of fat which is surrounded by thin layer of phospholipids and attached apoprotein B48 to increase the solubility. These chylomicrons are used to give free fatty acids to the adipose tissue and to the muscles, for example, for the further oxidation or synthesis. Oxidation directly will be done. More important, this is a formation of stored lipids, yes? When it will be necessary, free fatty acids with the albumin or in the content of low density lipoprotein will go to the liver where there are receptors for them. Remnant chylomicrons will be recognized by special receptors in the liver and taken. Then liver will synthesize their lipids and formate very low density lipoproteins which are already contain some additional apoproteins like A, C, E. They are circulating in the blood, lose part of their free fatty acids and change meet some of chylomicrons, some of high density lipoproteins. There is exchange of apoproteins between them, and finally they will be intermediate density lipoproteins. Density, as you remember, depends from the quantity of proteins in ratio to the quantity of lipids. So more and more lipids, it will be higher density. Less and less proteins, more and more proteins, apoproteins, it will be higher density. More lipids, it will be lower density. And of course, low density lipoproteins, they contain significantly higher quantity of cholesterol, which is not protected from the interaction with the vessel wall, and due to this they are more atherogenic. Then several times low density or intermediate density lipoproteins return to the liver where they will obtain new structures into the hydrophobic nucleus. More phospholipids are attached to them, less quantity of triacylglycerols, and finally high and very high density lipoproteins functioning like a carrier of cholesterol back to the liver. So due to their content, high density lipoproteins are not atherogenic because lipids are protected by the greatest quantity of phospholipids, by the greatest quantity of apoproteins. They are protected from the atherogenic action, from the interaction with blood vessel wall. And bad lipoproteins, low density, because cholesterol that is present in them in high quantity is more dangerous, of course. It is not protected and it is more atherogenic. Remember this. Very quickly we will pass through the stages of atherosclerosis development. So as we told, normally from lymph, from the intestinum, chylomicrons, at first they contained only one apoprotein, then by the interaction with other lipoprotein in the blood, ApoC2 obligately must come to be recognized by the lipoprotein lipase and special receptors on the endothelium of the blood vessels. Triacylglycerols will go inside of the muscles or hearts or adipose tissue, mainly free fatty acids. As you remember, glycerol phosphate can be formed only from free glycerol only in liver, so it is not utilized in the adipose tissue. Then remnant are taken by liver, by the special receptors in the liver, and converted then to lipoproteins with more higher density. But sometimes when there are special factors that injuring blood vessels endothelium, leads to the coming of the part of cholesterol, esters, and part of the triacylglycerols under the intima of the cells. So the most important things, this is injury of disorder of the surface of the blood vessels, and of course special oxidation of the lipids that are present in low density lipoproteins and chylomicrons. Chylomicrons less, but low density lipoprotein can be modified by the special mechanism. It's alcohol, it's a smoking, it's a uptake of special drugs, it's oxidative stress. Different mechanisms will lead to the start of the formation of the plaque under the intima of the blood vessels. Then modified lipids are recognized by these receptors, and they start to bring more and more lipids to the plaque, because modified lipoproteins stop to be recognized by the normal receptors, and normal pathway of lipoprotein metabolism will be disordered. Finally, more and more lipids will be here, more and more inflammatory substances will be produced, monocytes will go here and be converted to macrophages, start to eat this fat, trying to isolate this fat from the body, but will be converted to foam cells, die here. The muscles and fibroblasts will come here, will migrate here, start to produce even collagen, then calcification of this fatigue, and independence from the stage, independence from the size of this plaque, the circulation of blood through the vessels will be disordered. The blood vessel will be more narrow and more narrow till the complete occlusion of the blood and thrombosis of the blood vessel. In short, complication of atherosclerosis, right, from different organs, the same situation. It's hypoxia with the ischemic attacks, with the angina and heart attack, with the stroke and transitory ischemic attack of brain or insults. That this is kidney failure with the formation of kidney insufficiency. This is the problems with erectile dysfunction, and these are limbs problems when the most important blood vessels supplying our legs and arms are disordered, with the atherosclerosis of the limbs vessels, and all the complication of this. So please we have nearly 3-5 minutes to look through the last topic for today's lecture. Several words about eicosanoids. During the classes we have no many time to discuss them, so some basic positions. Right, please, that eicosanoids, it's a group of very functionally active substances that are formed in our body from arachidonic acid. It's a precursor of all eicosanoids with the old short name prostaglandins. Now we know that prostaglandins is only one of the representer, one of the group of eicosanoids. Also to this group the leukotrienes, thromboxanes and prostacyclins belong. We are synthesizing arachidonic acid from the linoleic acid obtained from the diet, because this polyunsaturated fatty acid cannot be synthesized in our body. You know that these are essential. Linoleic, linolenic acid are essential for us. So arachidonic also sometimes named essential because it is synthesized from essential, but really it is synthesized in our body but from essential fatty acids. And the biosynthesis of eicosanoids will be done in endoplasmatic reticulum, also with participation of enzymes that are named enzymes of microsomal oxidation. There are two pathways of eicosanoid synthesis, so-called cyclooxygenase way and lipooxygenase way. Lipooxygenase, remember, LL, letter L. Lipooxygenase is necessary for leukotrienes formation. All other prostaglandins, prostacyclins and thromboxanes are formed with the help of enzyme which is named cyclooxygenase. It's a general name. There are several cyclooxygenase. You will learn this in further courses. At this moment only overview of this process. So for the revealing of arachidonic acid from the phospholipids of the membrane, after the special signals when it is necessary, phospholipase A2 will reveal arachidonic acid that after this will be converted by cyclooxygenase to the prostaglandins, prostacyclins and thromboxanes, and by lipooxygenase to leukotrienes. So look to the structure. This is repeating of the acidic structure but some changes. Leukotrienes non-cyclic, different special things are attached to them, and leukotrienes perform the functions of immune regulation mainly, interaction between leukocytes of different types and regulation of inflammatory processes, exchange of information between the immune cells. Prostaglandins regulate different function from smooth muscles contraction till the arterial pressure, till the formation of the contraction of the uterus during the labor. It's also inflammatory processes regulation. Thromboxanes regulate blood clotting, and prostacyclins prevent blood clotting because prostacyclins are localized on the membranes of endothelial cells. Look that they are cyclic forms containing and divided to the several classes. Classes are marked with the letters A, D, B, G, I, F, and small letters indicates quantity of double bonds in these teals that still present in their structure. So if this is PGI of 2, it means that this special ring is contained by the representatives of this class, and 2 double bonds here. Same here, PGE, prostaglandin E2, also 2 double bonds contain. In thromboxanes, they are also with a cyclic, but the form of this cycle and substitutors, this is hexacycle, here you can see pentacycle, we divide them to the different classes. So classes are due to structure, and from the structure function is depending. Finally, what I wanted to say, that the mechanisms of action of the drugs that we are widely using in our practice, non-steroid anti-inflammatory drugs, they influence to the fever, pain, inflammation by blood clotting, by the inhibition of cyclooxygenase, a different stage of prostaglandin synthesis, of eicosanoid synthesis. Here, they also can inhibit lipooxygenase also. But glucocorticoids that we are also using, steroid anti-inflammatory drug against of inflammation and allergy, are working a little bit less individually because they are start to work on the stage of phospholipase A2 action. They inhibit phospholipase A2, and due to this, arachidonic acid is less revealed from the membrane phospholipids, and production of all eicosanoids can be decreased. So this is more not precise action of glucocorticoids in comparison with non-steroid anti-inflammatory drugs. But you know that glucocorticoids are also widely used in treatment of the allergy, inflammatory disease, and you must understand that their action is significantly more wide than non-steroidal anti-inflammatory drugs. Thank you for your attention. Hope that you were with me all the lecture. Goodbye. Be happy.